Today on Dr. K's Exotic Animal ER, a guinea pig comes in crashing.
Guinea pig's owner? Guinea pig's owner?
A ferret has an emergency surgery.
This is a really angry belly. I don't like how that belly looks.
And the team rushes to save a cockatiel's life.
I need oxygen and a technician.
You got this. I got that. Go.
It's a typical day in South Florida, but at Broward Avian and Exotic Animal Hospital, Dr. K and her team know that working with exotics is an unpredictable business. This morning, Dr. K's first appointment is with Oinkers, a 14-week-old pot-bellied pig.
When a pot-bellied pig walks through the door for a surgery, my first thought is, how big is it?
My name is Melanie Williams, and we're here to have our pet micro-mini pig spayed.
The reason for spaying pot-bellied pigs is to adjust behavior problems and to prevent uterine disease later in life.
This one will lay right up on you like she's doing right now. They're very loving, very sweet pets.
Hey, good morning. How are you?
Good, thank
Hi,
you.
I'm Dr. Kelleher. Nice
Melanie
to meet you all.
Williams, nice to meet
hey,
you.
Hey, you must be Oinkers. Hello, Mama. I heard you did the photo. Oh, it sounds very cute. I have had some really enormous pot-bellied pigs walk through my doors that needed surgeries. Thankfully, Oinkers is itty bitty teeny tiny and as cute as they come. One other major question: have you noticed any itchiness?
No,
Got it.
we try to keep lotion on her.
Okay. The reason I ask is that it's super common for pot-bellied pigs to get scabies.
Okay.
Scabies are a mite that gets in the skin. It likes to burrow deep into the skin, and it causes very, very, very severe itching. And it's extremely common for the pot-bellied pigs to come in with scabies.
Because we got it with the first pig.
Oh yeah, and it's not fun. I've actually had people go like me like this and lift their shirt and there's this rash. I'm like, yes, 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 that is the rash.
It was so embarrassing when I had to call my dermatologist and say, I think I have.
You're not alone.
Yeah.
You're not alone. You're not alone.
Well, then explain that you got it from your pig was a whole nother explanation.
All right. Hola, miss thing. Oh, she's gonna be making a lot of noise.
Yes, she
A lot
is.
of noise.
So loud.
I know. It'll be all right, though. All right, little Mustang. You gonna scream when I take you back?
Yes.
Oh, little mama. All right, well, let's get it over with. You wanna take your blankie with you? I know. Not the first, not the last. I will talk to you right after surgery, okay?
While Oinkers is prepped for surgery, Dr. K is called to see a ferret in distress.
Jed the ferret is here, and he's had a really long night. His mom and dad are both pretty worn out and very worried. Hi, how are you? I'm Dr. Kelleher. Hey, sweetheart. Yes, let's see what's going on, baby. So I got from the nurses, he has roughly a 4-year history of just intermittently every now and then he'll prolapse the rectum.
Indeed.
Okay. A prolapsed rectum in a ferret is where some of their rectal tissue protrudes out through the anus, and what you see is red and inflamed tissue.
We were playing, he was leaping around, he had a prolapse. We'd been advised before to just cage him, let him try and heal himself. And 24 hours later, he was completely lethargic, and he's never lethargic ever under any circumstances.
Yeah, this is
This
not
is
normal
not
for
him,
any ferret. I know. Let me get a good feeling there. Oh, you got something in your tummy. You do feel like you got something in your tummy, Angel. There it is right there. I can just feel something slipping on my fingers right here, and I'm gonna let you feel it. There's something hard right there between my fingers.
Mm-hmm. Yeah.
Can you feel that?
Yeah, I can feel that.
Feel that.
Yeah.
And it feels like, to me, a hairball in his stomach. And it's not uncommon for us to see this in ferrets. And it's what we call an occult hairball. And what I mean by that is that it's kind of like this secret hairball that it just kind of, it rolls around in the stomach. This constant rolling around in the stomach causes just a chronic gastritis, usually chronic diarrhea, just general unwell. And this ferret had been having all of those things for a very, very significant period of time. He does feel like he has some loose fluid in his abdomen, so I am concerned about even a possible perforation with his stomach. I know, baby, shh, 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 shh. I know, Angel. It's gonna be okay. I want to give him something for pain, like straight away, just because he's just so uncomfortable right now. I'm just gonna go get him a little injection for pain and then go over a plan. That ferret has me in high alert.
Yes,
There's badness in the belly.
and it's been going on for a while.
I feel like there's loose fluid in the belly.
Yeah.
First thing I want to do is just get him some pain meds. His belly hurts so bad.
Yeah, imagine.
Just look at his eyes. He just has a
That's why I said he looks like he's painful.
dumpy ferret look.
Yep.
Oh, he just does not feel good, baby, I know. I know, he just does not look good. He just feels like crap. Whenever I get ferrets in, my heart just goes out to them. They have some really bad things that happen to them. We just want to make this little guy comfortable.
Shane, the scarlet macaw, is here for a checkup after having a broken leg and many other health problems in the past year.
She was spooked by an animal, I guess a raccoon or something, and broke her leg. So I think that was the start of the whole spiral. This is my little Mercedes, because it's been an expense, but it's something that I would never, not even thought of not doing.
And I know the weather's been miserable, so it's been probably impossible to get her outside at all.
Oh, I take her out anyway.
did?
She
Good,
loves
good.
she loves the water.
Super, perfect.
Flaps her.
I'm gonna tell you something. I could give you all the medicine in the world, but I'm telling you, fresh air and sunshine.
I take her out and I let her walk the driveway.
Perfect. That is the best medicine in the world for these animals. I want to get a bumper sticker made that says, "We can't live without fresh air and sunshine. Why do we expect our pets to?"
Shane has aspergillus, a fungus common in South Florida.
So she needs an antifungal twice a day, and he has a very difficult time medicating Shane. I don't know how you feel about giving injections. I have taught owners how to give them. Okay, got it. Got my answer.
Hi, Shane. We missed you.
Because Donald is not going to ever touch a needle, and Shane needs to get the drug into Shane's body with a needle. Donald's not doing that at home. We're just going to be seeing Shane on a fairly regular basis. The other client is super, super compliant with the medications, but not getting fresh air and sunshine. He's shaky on the medications, but she's getting fresh air and sunshine.
Natural magic.
Natural magic.
Suddenly, an emergency comes in.
This is Chloe, a 6-year-old guinea pig, and she's seizuring. If you could just get me permission for an IV catheter. I need to hurry up and talk to these owners about getting permission to go ahead and get an IV catheter and get some fluids in her immediately, or we're gonna lose her. So, guinea pig's owner? Guinea pig's owner? Where's the Where is the guinea pig's owner? Are you the guinea pig? Oh, so sorry. Hi, I'm Dr. Kelleher. Hi. I just wanted to get your permission to put an emergency IV catheter in straight away. Let me get with her immediately, okay? And Janine's gonna get any other history from me, okay? Thank you so much. It's extremely important that we run blood work. These animals are so tiny, fragile, so sick by the time that they get to us. We don't have the luxury of waiting 24 hours until we get some results back. This is a 6-year-old guinea pig, and what I'm gonna do, because the animal is doing very, very poorly, is we're getting some emergency blood work right away just to see what her electrolytes and her blood sugar is like. And because her blood pressure is so low and she's doing so badly, we're gonna put in what's called an IO catheter, just so that I can get emergency drugs and fluids into her. This is a little bit of a painful procedure, so we're gonna put some Marcaine on her knee first. 0.05 of straight Marcaine on her. Shh, Angel, I know. Oh, baby. Shh, 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 shh.
Oh, honey, it's okay, it's okay.
Shh, 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 shh. There you go. Oh, her blood sugar is less than 20, so that's why she's seizuring. I know, Mommy. I know, Mama. I know. It's just gonna stink for just a second. Right, that feels in. That's in nicely. Is this the dextrose? Got it. This is called any port in a storm. When you have a really badly seizuring animal, sick animal, it would take forever, if you even could, get an IV catheter into her. So that's why I went in the bone. It's called an interosseous catheter, and it's a very, very, very effective way to deliver fluids or medications. So her seizuring should stop pretty shortly. All right, that's a good catheter, so let's protect that.
Although Dr. K stabilized Chloe, Dr. Thielen is her doctor. After finishing up with another patient, Dr. Thielen gets up to speed on Chloe's case before seeing her owner.
My name is Monica Braverman, and I have a guinea pig, and her name is Chloe. Yesterday she started not doing well. She couldn't get up, she wouldn't eat, and we thought she was gonna pass away. My daughter made me promise her that I'd stay up and look after her.
She's stable at the moment. Her blood glucose was so low. It could be just she hasn't eaten in so long, but really your body should maintain its blood glucose no matter what. So the other things I think of whenever I have a really low blood glucose is a really bad infection in her bloodstream. But other things that can cause a low blood glucose is cancer, unfortunately. I don't know that, and so that's why it would be prudent to look and to see how are her kidneys, how are her liver, how is everything else in her body doing. We need to get her out of this crisis, and I want to keep her today in hospital with that catheter in, on fluids with the sugar in it to maintain her blood glucose to see if she'll perk up. She's making me nervous.
Baby.
After Jed the ferret has been given pain medications, Dr. K checks on his condition to determine the next course of action.
We've given some time for these pain meds to kick in, but this little guy still looks very painful. We're gonna go ahead and get the x-rays and try to find out what's going on.
Prepping.
Good. My baby. Let me go check Jed's x-rays. I do not like that at all. I just don't like the loss of detail here in a big way. When you have a loss of detail on x-rays, it's usually because there is fluid that is obscuring the organs. It just makes everything kind of all blend and mush together. I think this is gonna be a messy abdomen. See, there's a hairball right there. Can you see it? My extreme concern is that there's a perforation in the intestine, and if that's the case, it drastically affects this little guy's prognosis.
Dr. K has exhausted all options with diagnosing Jed the ferret, leaving emergency surgery as the only course of action.
I am gonna make this ferret feel a lot better, I hope.
Surely hope so.
It just hurts to look at him.
Ready, set, cut.
I don't like how that belly looks.
This is a really angry belly.
It looks
very red.
really, and I didn't even do anything to it yet. This belly worries me. This belly looks icky. Oh.
So red in there. It does look very icky. I hope nothing horrible has happened.
Oh, yes. That's what I was afraid of. This is a very unhappy belly.
Does that smell funny?
Yeah. As soon as Dr. K opened up that abdomen and all the intestines just came out and they were just red and irritated and just looked like they felt miserable, I knew something bad was in that abdomen.
Oh, that is bad fluid. This fluid that's in Jed's belly is infectious fluid. That means we most likely have a breach of the intestine here. Peritonitis is an infection inside the abdominal cavity. It can happen when anything in the abdomen bursts, for example, an appendix, or if there was a perforation in the intestine. Oh, can you feel that? That's the hairball. Oh, that looks evil. Look at that. Oh, this poor thing. I think this animal perfed, because that is mucousy stool. That is what I was concerned about. Yeah, it's peritonitis. There's an infection everywhere. There's GI contents loose in the abdomen. So what I'm doing now is I'm basically what's called running the intestines. You start at the stomach, and I just carefully go centimeter by centimeter down the intestines, just examining very carefully the entire length of the intestine meticulously. Oh, this belly is bad. Okay, I'm gonna go to the other side of you.
Okay.
There's reperfed. Damn it. That's gonna suck. It's angry.
Do you think it perfed because there was so much back pressure from the stomach?
I think the hairball was the start of the whole shooting match. The fact that the ferret had a, I'll take that, it had a fever of 105 last night, fluid in the abdomen. I mean, it just is like, that's a picture of peritonitis right there, and that's what I was expecting to find. And that's what I was concerned about with the owner. Oh, that needs to be resected. All right, well, we gotta do what you gotta do. A resection is when we actually take out a section, completely cut out a section of intestine. And then what you do next is called anastomosis, where you take the remaining healthy tissue and sew it back together. This is so necrosed that we actually need to resect this section of intestine, see that it perforated all the way through. Thank God we opened this abdomen today. This animal would have been dead tomorrow. Look at that section of bowel, too. Look at this piece.
For not to take that home.
I really wish I could get a hold of these people on the phone. I want to give them an option, honestly, because this prognosis is very bad. It's extremely rare that I do this in a surgery, but in this case, I'm going to call the owners while I'm in surgery, because this is really tipped the cards in a different direction. I want to get these people on the phone because they're. Can you have somebody get them on the phone?
Yeah, I'll put my head up.
While Dr. K tries to get the owner on the phone, Dr. Diaz is seeing Portia, a sugar glider in pain.
Kind of noticed there's like a little growth. It wasn't there a few days ago.
Come over here, silly. A sugar glider is a marsupial. They come from Australia and Indonesia. They are animals that can live up to 10 to 14 years. It's very important for people to understand that these are animals that are highly social, and so having a single sugar glider in captivity is not the best idea. Alrighty, what I'm seeing here is a scab. I mean, this growth here is not really a mass or a tumor, it's just a big scab, dry blood.
Did she get cut?
It could have been a cut. Her nails are very long too, so she could have just scratched herself and it got infected. I would like to put her under a really brief anesthesia to clean the tissues and the bride and remove all the dead tissue. Go sleepy, it's okay. All right, so we've removed the scab. It was very, very severely infected and full of debris and hair. Let's take a quick picture to put on the record. I often take pictures of the patients that come here, especially if there's a wound, just so that I can keep track. Now, you can see that we've removed the infected tissue. There's a really big wound, bigger than I thought it was gonna be. And it's clean now. We put a little bit of soother cream. Now she's waking up. Just to show you real quick, the wound it's extensive. There it is.
Okay.
If you could send me a picture of the wound so that I can monitor. The picture that I took, I'm gonna put it on her record so that we have a reference and we really can tell if this is getting better or not. If Mark and Rachel are compliant with what we told them to do at home, Portia should be fully recovered in a couple weeks.
I'm getting Judd's owners on the phone because the game has really changed. His prognosis is definitely tanked. I just want to get in touch with them because the prognosis is just so much poorer now.
It's the owner.
Okay. Hey, this is Dr. Kelleher. We are in surgery with him, and the reason I'm calling intraoperatively is that things are even worse than I expected. He has a raging peritonitis right now. It's an infected abdomen. The large intestine has ruptured in 2 spots, and I'm having to resect a section of the intestine and sew it back together. My biggest concern is the bowel dehissing, in other words, coming apart, because the protein is so low. His overall prognosis is pretty poor. I rarely call owners in the middle of a surgery. And the main reason I'm calling is I wanted to know from you if you wanted me to keep proceeding.
It's the owner.
Okay. Hey, this is Dr. Kelleher.
Jed's surgery has revealed a life-threatening infection. Dr. K wants to make sure his owners know the risks before proceeding.
I understand. Okay. All right, bye-bye. Jed's owners are all on board to save Jed. We're gonna do what's called a resection and anastomosis, which means I cut out the affected portion of an intestine and then suture the healthy sections back together. You can do it. I know, my little optimist. I'm glad you're here. This poor guy, he loves his ferret. I know this looks bad, but we gotta stay positive. So here's what we gotta do. You gotta go up, up and over. All right, thank you very much.
Let go. I got this.
And I'm just steadying myself on that.
Oh, okay.
I do not like his heart rate. Can I have a syringe and a little more fluid? I just wanna see where I'm at as far as the ship holding water. Got it.
Dr. K wants to see if the intestine will hold water or leak.
That's actually looking really good. That's looking shockingly good.
Leave it alone, just tie it.
I agree.
Dr. K?
Yep.
This ferret's owner is on the phone.
Yes.
He wants to euthanize.
Oh my God. I just finished the resection and anastomosis, and it held water.
He's just concerned that he's keeping him alive more for himself than for the ferret.
He is doing crappy under anesthesia, and his belly is septic.
And you've still got, what, another 30 minutes on surgery?
Yeah, I know. Raging peritonitis, 2 perforations in the bowel, anastomosis, resection, low albumin. He's gonna need a transfusion of plasma, and I haven't even gotten to the hairball
So if he's
yet.
not all in it, then we need to stop.
Good job.
Yeah, you yourself, too.
I wish I'd seen one like a month ago or something, last year or something. As soon as I opened the belly and I found that perforation, the whole picture just changed. His percentage of survival rate went from 90% to like 25%. And I need to let people know that so they can make an educated decision. And it sucks because he really loves his ferret. You can see how much they cared about him, but that was the right thing to do.
The decision to euthanize Jed on the table was a good decision. Chances are he just would have suffered for a few extra days.
In your mind, as a veterinarian, you're on the path of, okay, we're gonna save this animal. And then you're having to switch gears and put him to sleep. It's hard, it's disappointing.
I don't know if Jed would have made it or not. That would have been some serious recovery. I don't know if I would have put my own animal through that.
We learn to, what I call, compartmentalize, because we have to go on and see the next patient. You have to go on and do the next procedure. You can't just go home because something bad happened. I did the best I could do.
Ferrets are a popular exotic pet in South Florida. Dr. Diaz is going to see Cooper, a new ferret patient.
Well, I'm Janice, and we're here because we wanted to see what was wrong with our ferret.
Name's Paul, same thing.
Well, we're here with Cooper today. Our pet has what looks like a burn or an injury to the right side of his face. And if he continues with this, he's gonna die, so we take care of it.
How are things going?
Not so good with our little buddy here.
I'm really concerned because I could smell it from far away. He smells, he's so infected that he has such a strong smell.
I thought that was me.
No. I know that he chews at his cage, but this looks a lot like a burn when they chew cables. Have you checked your cables?
The thing is, though, is that once they do that, wouldn't that, stop the electricity from working?
No. Ferrets, in general, they are very playful. They love to hide things. They go into your purse, get something out, and they usually would have a hiding spot in the house. Even though they tend to chew at cables, it's very rare when they actually electrocute themselves. We have a huge wound. Is he eating?
Yes, he does eat baby food bananas at times. He just walked up and I thought, okay, well, this is good. They won't eat raw meat. And of course, you can tell he's under stress too because he looks like he's thinning a little bit.
Yeah, he's
dehydrated.
A little thin. He's
I
definitely
could give him
thin.
sugar water, couldn't I?
Definitely no sugar for these guys. They're carnivores. You don't want to load them with sugar. But here's the thing.
They like stuff with sugar, don't they?
I love bacon and I love ice cream, but that doesn't mean that it's good for me. But going back to the main problem, this is really serious and I'm very concerned. I think the most important thing that we can try to do today is 2 things. One is to do a really brief anesthesia because we need to try to clean as much of that. We need to try to, first of all, get a culture to see what is growing. And second of all, is to clean it as the best that we can.
He's not gonna die, is he?
This is very serious.
Cooper, a 2-year-old ferret, has an electrical burn on his mouth. Dr. Diaz is worried about infection.
Let me see your face.
It is very serious because this infection already is causing severe necrosis of the lip. But then, if he lets us, it's starting to affect the gums. It can distribute or go through the blood and go places, tons of different places, wherever I want. So it's extremely serious.
It's okay, Cooper.
Basically what we did is we put Cooper under anesthesia. What that means is we put a mask on his face that is going to deliver a gas. While he's under, we can open his mouth and evaluate all the tissues that were affected and to see how extensive the burn was.
He's gonna start waking up soon.
Ugh, the tongue is infected too. Hold on. Open the mouth to put the tube in the middle. So I want to culture the infected area so that I can determine what bacteria is growing to choose the best antibiotic therapy.
Dr. Diaz will clean Cooper's mouth wounds with a disinfectant and then begin intravenous antibiotics to clear any infection that might travel through Cooper's body.
That's how severe the infection is. It smells terrible. This can happen real quickly if it's a severe burn. Obviously, the burn right away is gonna kill this tissue, and then everything else around is just infected and responding to it. Obviously, we can see the extent of this is terrible. I feel so bad for him. And he's still acting like nothing happened. He's still eating, which is really good. So hopefully he'll respond really well to the antibiotics. Before the patient wakes up, I'm gonna give some fluid subcutaneously, which means under the skin.
While the fluids take effect, Dr. Diaz goes in to meet with Cooper's owners to give his assessment.
All right, guys. I was able to get a really, really good look now. And also even the tip of the tongue is infected. But we cleaned the area with disinfectants. We gave him fluids, we cleaned everything up and woke him up. Cooper's prognosis is really good, provided the owners give him medications and maintain him away from electrical cords. And it is always important for people who have ferrets to baby-proof or ferret-proof their house, because ferrets can get into anything.
Chloe, the guinea pig, was brought in with seizures, so Dr. K's team stabilized her.
Chloe is stable, but I don't think she's doing great. It really hasn't been long enough for me to completely see how she's gonna turn around, but her mentation, meaning her attitude, is very depressed, so I'm nervous. I don't think she's doing so good.
Chloe's owner, Monica, has returned to share something with Dr. Thielen.
You're gonna think it's strange, but my daughter taped her a message.
Really?
Yes.
For her to listen to?
For her to see and listen to.
Oh, that's not strange. That's adorable. Yes. Oh, that is so cute. But she's right in here. But you can pet her.
Amiclosita, it's your mommy. I love you so much. I think you've been a great, great, great Guinea. The best Guinea ever. Whatever you do, it's okay. I love you more than anything. I love you, baby. I just want you to be happy. I love you. I love you.
Oh, my goodness. Oh.
Bye.
You're gonna make me cry. Oh, your daughter is amazing. That's so sweet.
And she gives her a smile.
The thing about being a veterinarian is, of course, we love animals and we feel for the animals suffering, but at the same time, whenever you have an owner that is so upset, it's almost just as heartbreaking as the animal not doing well. I will talk to you soon. Okay, you're so welcome. You're so welcome. I know you're gonna take good care. I will, I promise. Bye. When I have a guinea pig sitting in front of me that's not doing well, I need to hunt and figure out why the animal's seizuring, so blood work is a good place to start in this case. You're being so good. Good girl, Chloe. Oh, baby girl, I'm sorry.
All right, don't do that. Don't move, don't move. Good girl.
It's extremely important that we run blood work.
Good Chloe.
These animals are so tiny, fragile, so sick by the time that they get to us. We don't have the luxury of waiting 24 hours until we get some results back. So the big picture on her, she's 6 years old, female, unspayed.
It could be scabies, it could be ringworm, it could be sepsis, or it could be kidney failure.
You know what I want to know? I want to know, do we have a blood smear to look at? Just maybe a blood smear. I just want to see, do we look septic?
Okay. Okay, thank you.
Chloe's blood smear will tell the doctors if Chloe is septic, which would mean she has a severe infection.
I've got a really good microscope, and there's just nothing like looking at the cells yourself with your own eyeballs. There are bacteria in the bloodstream. There, this animal is septic.
There is bacteria in every single white blood cell and all throughout the background of that slide.
And that means that she's septic, which explains why her blood sugar was dropping. And bacteria in the bloodstream eat up all the glucose, and it causes it to drop very low, and that's why Chloe was seizuring.
Because her case is so severe, really the next step is to give the prognosis to the owner and see what she wants to do.
Excuse me, I need oxygen and a technician.
Got it. You got this. I got that. Go.
A 17-year-old cockatiel has come in critical condition and bleeding from the mouth.
Got it.
Bleeding from the mouth.
Got it.
17-year-old cockatiel.
I got oxygen. Shh. Fluid in the belly. Lots of fluid in the belly.
Yep.
Got it. No. It's off. Oh, good. Thank you. Was it trauma or was it just an acute? He's dying.
It's gone.
Sorry. He's got a belly full of fluid. Oh my goodness. God in heaven. He just acutely went like this.
This cockatiel had been boarded somewhere while the owner was traveling. And when she came back to pick up, this animal had a little bit of bloody discharge coming out of the nose. When I started feeling it around,
Suddenly it had blood pouring out of its mouth.
oh my God.
That is nothing you did. That bird is
No,
just...
I know, this day sucks.
This day really sucks. Some days, everything comes in dying and critical and crashing, and there's not a lot you can do about it.
Everything starts sinking in, and you start thinking about what happened, what did I do wrong, is this just too advanced, I couldn't have done anything. It's definitely one of the toughest ones.
Winkers, the 14-week-old pot-bellied pig, has been waiting all day. Now it's time for her to be spayed.
Oh, she's so quiet now, poor little thing. She's so sweet and she is so cute, and you just pick her up and wee!
This little pig so you can sit in your lap. He's a lovely. Are there any animals that we deal with other than reptiles and birds that the males are absent of nipples? I don't think so.
In what, pigs or mammals in general?
Just in the animals we deal with, are there any of them?
Male guinea pigs have nipples?
Well, she's asking if any
Rats
do. Rats do too, right?
Everybody has nipples.
Yeah, that's what I thought. Well, because the owner was like, got really mad at me. I called it a boy, and they're like, it's a girl. It has a nipple. I was like,
no, people think
well,
that.
they
Yeah.
all have nipples. But then I was like second guessing.
nipples.
I was like, does everyone have a nipple?
You know.
All right, my friend, let us go. She's a bitty pig.
Get your parts out here, girlie. We do not want any bleeding in the bottom of a pig belly. This is the horn of her uterus right here. That's one horn.
You spay the pigs early because that way the uterus is as small as possible. So it's less to fuss with.
See how these intestines look pink? Kind of whitish pink and pretty? That's normal. That's normal intestine. Whereas when we saw Jed's intestine, how the intestines were super red, and I mean, that was a sad abdomen. And this is a technique a veterinary friend of mine taught me a long time ago. Keeping track of your tail of your suture. You know how to do that now, right?
Yes, I don't make it look as good as you do.
Well, I've done it once or twice. It just looks like a little zipper. Won't even know I was here. You smurf your knot on the end there like that. It is pretty. She can wear a bikini. Shazam, and you're done.
After reviewing Chloe's blood work, Dr. Thielen faces the difficult decision of determining what's best for the welfare of the 6-year-old guinea pig.
I have a blood bacterial infection, and if this was a 3-year-old guinea pig that was otherwise doing well, it would be a different story. But with the bacteria in the blood, the kidneys compromised, and her age, I just don't think I could fix her in time for me to resolve the infection and me to resolve the kidney failure. There is a significant amount of bacteria in her bloodstream, and I just feel that she's suffering.
Yeah, I don't want that.
And we don't want that. And she has lived a very long and amazing life. You're a good girl, Chloe.
After discussing Chloe's situation, Dr. Thielen and her owner decide it's best to put her down.
She's a good pig, and we love her so much.
Good job.
Yeah,
6 years is a long run.
Yeah,
Sleepy pig.
girl. You're a good piggy. Okay, so she breathes like this because she's under anesthesia and she's a rodent, and that's just how they breathe. I'm gonna give an injection right in there whenever you are ready, though, okay?
Go for it.
Okay.
I can see.
Okay.
That's it.
She's gone. I'm so sorry.
It's okay.
I'm so sorry. It's okay. She's a good pig.
Thank you.
You're very welcome.
Oh. Sucks. I know, I'm sorry.
This animal was part of their family, you know?
I know.
I get really emotional like when the owner is just the nicest person ever and they want to do everything possible, but just sometimes you can't.
Pot-bellied pigs are becoming more and more popular here in South Florida, and we're seeing them in for spays on a regular basis. And we have Zoe here today, and she is a lot bigger than Oinkers.
She's my daughter. I have 4 sons. She is literally my daughter. My kids think I'm crazy, but you know, she means everything.
Good morning, Zoe. Hey, baby girl. Oh my goodness, you got so big, little mama. I heard you did not want to get out of the car to come see me today.
Goodness, no.
What is that? Can you smell that? Is that okay with you? What I am a little concerned about is her weight. How much is she eating a day?
Like about 4 cups a day.
Okay, that's about 3 cups too many.
Really?
Really?
She screams and cries, though.
I understand, but we're gonna wind up with dramatic problems with her joints. They're very prone to arthritis. I mean,
so right now she's typically overweight then?
She is. I'm a little concerned about that. Zoe's a big pig, and she's overweight. She's not just a big pig, she's a fat pig. And that is going to make her surgery more complicated. And there's vascular layers in the fat.
Once she's anesthetized, Zoe the pot-bellied pig is ready for her spay.
Mommy says she cries if you don't feed her, so she keeps feeding her more and more, and she's a little bit obese, which makes the surgery a little more complicated. Look how thick this layer of fat is. Hey, the layers of fat. Oh, my goodness. I'm gonna use our handy-dandy Lone Star retractor. Oh, hip, hip, hooray. It's just he's got such a curly uterus that every time I try to throw a ligature down, you just hold all the curls out of the way. You're doing great. Just having a pair of hands to hold the whole kit and caboodle out of my way is lovely. And then this is all uterus. You keep pulling and pulling and pulling and pulling. Now I'm just cutting everything out.
She's cutting the uterine stump.
Where's the bleeding coming from?
It's right there. Do you see it?
Got it. Beautiful. Oh, good. 1, 2, 3. Okay, all stumps are quiet. There's no way anything else can be bleeding in here. Really, really, really well, because I never want to operate on her ever, ever, ever again. And we are good. Oh, little mama. Zoe's resting well after surgery, but I'm a little concerned because she's resting a little too well. She should start to be up and around by now. Her incision's not oozing. Everything looks fine, but I just... Come on, Mama. You're gonna get up. You know, when I squeeze this, it is oozing a little bit. Come look at this incision. Let's see if we can just sling her and get her upright. I know. I hope to irritate you enough that you would like to move your rear end. I know, Mama.
Pain. What's bleeding?
Zoe the pot-bellied pig is bleeding after her spay. Dr. K must find the source of the bleeding, or Zoe could die.
Where's it coming from?
Hang on.
I noticed. Yeah, that's not looking so good.
All right.
That's dripping from the incision, I think.
Yeah.
So I'm just really concerned about the possibility of her having some internal bleeding under her skin.
Wow.
So I really don't feel like we have any other choice but to go back in her abdomen. It could just be the subcutaneous tissue bleeding because she had like a layer of subcu fat this thick to go through. But I can't take that risk. No. I've got to go back in. I'm so sorry. I can't take the risk of her bleeding out. It was a very bloody surgery. It was very, very difficult.
Can I see her now or no?
Yeah, dear. Sure.
Okay.
Sure.
Oh my God, love.
All right, honey. We're getting everything set up to go in just a few minutes.
Dr. K and Dr. Diaz have no time to spare. They'll have to open Zoe up, find the source of the bleeding, and stop it.
Okay, Zoe, here we go again. Please be easy on Dr. K. If this is nothing, I'm gonna be so happy. But see, that's where she's oozing from. Oh, yeah.
Oh, yeah.
There is a little leaky spot here. The majority of the blood was really in that subcutaneous tissue that was this thick. I mean, I'm delighted that I didn't open this up and there was this huge abdomen gushing with blood. And I don't know anything I could do differently not to have that subcutaneous fat layer bleeding.
Have less fat pigs?
Well, yes, that would be very high on my list. You can see like this hematoma area in the subcutaneous tissue. That's where all the blood was. It's quiet. You and I are both looking at that, and it is not bleeding. It is quiet. Oh, Zoe.
All right, no more of this. No more.
That was a close call. We got the subcutaneous fat to stop bleeding. We got that under control, and I think she's gonna do great. But it's, you know, think about it. It's a reason to keep your pet at the proper body weight.
While Dr. K lets Zoe rest from her second surgery, Oinkers, the other pot-bellied pig, is ready to go home.
All right, Oinkers, time to go home.
Up, here we go.
Hi, Mama. Hi.
She woke up very nicely and no complications or anything. So she's gonna
happy. No, she looks great. She looks happy. Her tail's going.
Yes. See, no babies for Oinkers.
No, no babies.
Yes.
Hey. It went well. It went well. It was mostly her subcutaneous tissue, which was 4 inches thick, that had the big seroma in it. I would have been horrified if I had opened her abdomen and there was this pool of blood. I was like, ugh. But it wasn't.
Oh, good.
I want her watched by a doctor overnight.
Okay.
You know, it's a big deal, a big surgery. Sorry for the scare. I just, you know what? I could not walk out the door tonight and go to bed thinking that there was a stump bleeding, you know, gushing in there or something. I'm sorry to stress you out, honey. I know how much you love her. I know how much you love her.
Good news.